All right, can you just check on the bottom there? You should be able to click the little arrow just to change your slides. Yes.
Yep.
All right, fantastic. All right, so I'm going to go ahead. I'm going to just kind of start. I think it's a little bit, it's 11:04. There may be a couple of people who are joining us, but I think we can go get started. So hi, everyone. So welcome to our first site visit, and this is with Chrissy Lurkies, who's the director for the Office for the Aging. And as I stated, for these site visits, I'm going to give the floor to the individual who will be presenting. So that'll be Chrissy. As always, please, for the students who are in our session today, just make sure that your microphone is muted. And if you do have questions or, or whatnot, as you know, just kind of raise your hand or chat in the comment, and then we can have you guys ask questions or have discussion or whatnot. So again, thank you, Chrissy. So I'm going to kind of just go in with the audience here, and then if you need anything from me, let me know, but I'll be here.
Okay, Kathleen, what is our time frame? How much time do we have for like me to present versus Q&A at the end, if there is any?
So we have technically our classes from 11 to 12:20.
Okay.
So
perfect.
Yes, absolutely. All right, great. Thank you.
All right. So thank you, Kathleen, for allowing me to come in today and do this site visit with everybody. Typically, I'm in a classroom, but due to COVID, obviously that's not going to happen. This is something that I look forward to doing every single year. So I'm thrilled that despite COVID, I'm still able to present to you guys. And I just want to, put out there again, like anytime that there's any questions throughout this presentation, like Kathleen said, just put it in the chat box, raise your hand, so that way we don't have any questions go unanswered. So my name is Chrissy Lurkies. I am the director for the Essex County for the Aging. We are located in Elizabethtown. That's where our county seat is, as well as many other county departments that you may be familiar with. The health department, social services, community resources, so on and so forth. So at the Office for the Aging, we receive funds from the federal government. We receive state funds, as well as our local county tax dollars go towards help offsetting our budget. In 2020, the year that we're currently in, our budget is just over $2.5 million. And that comprises of all of our services, all of our staff, all of our maintenance and operations. So every funding expenditure that goes into the service delivery of our programs is funded by federal, state, and county dollars. What is something that we're always very upfront about with our older adults, that our services are delivered at no direct cost to any of the older adults or caregivers. So if somebody comes in and asks for services, or we deliver them a meal, they're not going to be billed for those services. That's one of the first questions that we get. That's why we're very upfront saying that these services are going to be delivered at no cost to you. However, I don't know if anybody is familiar with the Older Americans Act. The Older Americans Act governs all of our services and our policies and procedures in many ways. Due to the Older Americans Act, we have to provide an individual or a caregiver that we serve, regardless of services, what services we provide, the opportunity for them to contribute towards the services that they have received. This is typically in a letter form, so we provide a service. The next month after a service has been delivered, we send out a letter to the older adult saying, during the month of August, we'll just use that as an example, we provided X service at the cost of X amount of dollars. If you'd like to contribute back to the program, that's great. It allows us to enhance the program and hopefully not have a waiting list. But despite this, no person would ever be turned away due to their inability to or unwillingness to contribute. Our contributions make up a great amount of our budget, so we rely on those heavily. Here is a list of different programs, and I'm going to break these down to you one by one, so I'm not going to go through this list, but we'll go dive into these programs a little bit deeper as we move forward. So one of the most important programs that we provide is our assisted transportation and transportation program. And basically, in a nutshell, what this program does is it provides individuals that are 60 years of age and older that do not have active Medicaid, so that is the state-funded medical insurance that looks at income and resources for eligibility. If the older adult does not have Medicaid, but they need assistance with transportation to and from medical-related appointments, we can work with our volunteers through the Retired Senior Volunteer Program, and those volunteers literally go to an older adult's home, picks them up, brings them to the doctor's appointment, brings them back home, good to go. The volunteers submit their mileage reimbursement to us on a monthly basis, and we pay them a mileage, reimburse their mileage. They're not reimbursed their time. They're not reimbursed, for wear and tear on their vehicle. They're simply just reimbursed the mileage from their home to the client's home to the doctor's appointment and back. Any individual that needs transportation, they can call into our office. We have a transportation coordinator, and she'll navigate all the different transportation resources that we have to link them to the appropriate volunteer. Or in many cases, they sometimes are able to actually use our transportation system, our buses. Right now, due to COVID, our buses are not up and running. We just started last week doing a shoppers run to Saranac Lake and to Ticonderoga a couple of days a week, but they're not just up and running for regular transportation at this time. That is also true with the Retired Senior Volunteer Program. So any transportation that is being provided now is done by my staff. The Retired Senior Volunteer Program, those volunteers are older adults themselves, so obviously extremely vulnerable when it comes to COVID. So in order to make sure everybody is as safe as possible, all those services through the volunteers have been suspended. And again, like I said, my staff are providing that transportation. Next program that we offer is some support to our caregivers. If anybody has ever been in the caregiving role, you completely understand how hard it is to be a caregiver. You always put yourself in the back seat to your caregiver, so you may, unfortunately, skip some of those doctor's appointments, may not be taking the best care of your health or your mental health. So we want to provide these supports to caregivers that'll allow them all those opportunities and all the tips to make sure that they are taking care of themselves. Without a healthy caregiver, a care receiver, unfortunately, not going to receive the care that they need and want, thus resulting in possibly ER visits or hospital stays, or ultimately possibly even a nursing home admission. So we provide counseling and support groups, trainings to older adults, to their caregivers, whether it's in an individual setting, in a group setting. We're doing a lot of this over the phone now. We're going to be looking at doing some Zoom caregiver support trainings. We collaborate with the Alzheimer's Association and really disperse all of their information because they have a ton of great online resources and online training. So we're really trying to get that information out there, knowing that, we don't have access to internet in all of our areas. A lot of older adults or their caregivers may not be so tech savvy, but a ton of them are. So we want to try to do as much as we can. One of the in-house programs that we provide, which is a really great tool, is the Powerful Tools for Caregivers training. So this is a 6-week scripted caregiver training that brings the caregivers in and really gives them, like I said a few moments ago, it gives them the tools and the tips and all the resources at their fingertips to be able to be the best caregiver and keep themselves as healthy as possible. Next program that we offer, which I'm sure that many of you are already familiar with or have learned about, is case management. So case management really is in-depth care planning with a client, with their caregivers, their supports, whether informal or formal, to arrange for services from other community partners, not just our services, to provide continuous follow-up and monitor that person's current situation. Anybody that we case manage, we contact them at least monthly to ensure their safety and to ensure that they're receiving those benefits that are most appropriate for their current living situation. And all of our staff are state certified case managers through a CATER online training with Boston University. We case manage a ton of different individuals in a wide variety of manners, if you will. We have some individuals that we have almost daily contact with, and that's more of just over the phone support. We have individuals that we visit with weekly. They may need some assistance with just looking at their mail and determining, yes, this is a bill we need to pay. This is, junk mail. This is trying potentially a scam. We have individuals that we work closely with a bill payer program because they may need help paying their bills. Whether it's a health issue or maybe they have arthritis and they're not able to write those checks out anymore. Maybe they're having a little bit of memory issues and forget to pay their bills. So our case managers will work with the bill payer program to make sure that those individuals are being paid, as well as all those other services are being wrapped around them to ensure that they're able to age in place. Because ultimately that is our goal at the Office for the Aging, is provide as much services as possible that the person is willing to accept. They have to be receptive to our services. We are a non-mandated service, so if we go into a client's home or contact them and are a wide variety of services and they turn us down, they have that right to. I think in a few slides we'll talk about adult protective, so I won't go into that, but at any time if anybody is not receptive to our services, we have to respect that. Right now, we are right in the thick of the HEAP program. Some of you may be familiar with that. It is the acronym for the Home Energy Assistance Program. So we are the facilitator for the community heating funds for many townships. This is a little bit separate from the HEAP program. Some towns throughout Essex County, through charitable organizations or different organizations set up by the town, have raised additional funds for individuals in their communities that are experiencing a heating emergency. So I'm going to use, for instance, let's see, the town of Mariah has funds set up for anybody that is a certain amount over the HEAP guidelines. So they would be ineligible for HEAP, but they still don't have enough funds to be able to purchase their fuel delivery or offset their heating bill. So they contact us. If they meet the criteria set up by the town, then I can go ahead and work with their vendor and ensure that they get a minimal delivery of fuel oil or wood or what have you. It's kind of a lengthy process just because of checks and balances. So it comes to me, I work with the vendor, I get it, I approve it, then it goes to the chairman of our board, he approves it, then it goes to our treasurers, so on and so forth. But there are some options out there for not only older adults in many of the communities in Essex County. The HEAP program, Home Energy Assistance Program, is a program offered to all individuals just as long as they meet the for the regular component of HEAP, just as long as they meet the income guidelines. But this could range for somebody that is from 18 to 105 years old. They would, if they've received HEAP last year, they would have got an early outreach application, which we're already starting to receive right now. And if they did not receive HEAP last year, then they have to wait until the program opens, which is November 2nd this year. Then once November 2nd comes around, we can mail out a HEAP application. and we can walk them through the process because there is some documentation that they have to send in. So we're the alt certifier for the HEAP program. So that means anybody that's 60 and over that does not have active SNAP benefits, which a lot of people may refer to those benefits as food stamps, they would be able to apply through our office. Anybody that is under 60 or over 60 with SNAP, they would go through their SNAP benefit, their case manager, or through the HEAP department. Congregate Meals is a program that we contract out to Adirondack Community Action Program, and they operate 11 meal sites throughout Essex County. This is a place where older adults can come in and not only get a hot, well-balanced meal that they do not have to prepare themselves, but a great opportunity for educational opportunities, for socialization, just local, faces that our older adults are able to see on a regular basis to decrease any social isolation, vulnerability, the older adults may experience. Right now, due to COVID, all of our congregate sites have been closed. They've been closed since March 18th. I don't know exactly the date, but all those sites have been closed. We have due to executive orders from the governor, we've been able to provide or at least offer to all of our congregate participants the option for them to receive a home delivered meal now that they're not in that site to get those meals, because many people did come to the sites to receive the meal. They may have some financial or some food insecurities at home. Maybe they live in a food desert. Maybe they don't have the funds to purchase all the food that they need. Maybe they just couldn't stand long enough to prepare their meal, but they wanted to have that socialization opportunity. So they went to the site. And some could have cared less, quite frankly, about the meal. They just wanted to go and visit with their friends. So not all of our congregate meal participants have taken up the opportunity to get a meal, but some have. The other really cool thing, and we'll talk about this in a few slides, is at some of our congregate sites, all 11 are a little bit different. Some have a traditional noon meal, some are open for night meals, some offer breakfast meals. It really is tailored to their community and the culture in that community. So that's what is so it's really awesome that it's individualized in a sense to that township. But some of the sites are really, really extremely active. I'll talk about our Screw Lake site. It is embedded in their senior club building. So not only, do our congregate meal participants come in and get a meal, but they're part of the senior club. They have seniors on stage night where they have the participants come in and they act out different skits, and it's a riot to see that. We have exercise programs in our Ticonderoga site. There is, we offer, and we'll talk about this in a few slides also, we offer Tai Chi in an arthritis exercise program, but they have exercise equipment there through the senior club. They also have a very, very, very active pickleball group that they play every single day. So like I said, it's not just the meal. I think the meal could be a good reason that some go there, but not everybody. So we're hoping, depending on how our numbers look going forward with COVID positive cases, maybe we will open in a few months. But again, we have to see how those numbers look. Next program that we offer is ISEP, and that's just an acronym for Expanded In-Home Services for the Elderly program. And basically, this is a program that enables many frail older adults the ability to remain in their homes. So this program provides a well-planned, coordinated package of in-home and other supportive services designed to supplement informal care. As many of you potentially know, if you don't, many of our older adults in Essex County and in our region, so Clinton, Franklin, Essex, Warren, Washington, all of these areas up here, A lot of our older adults, in Essex County specifically, it was about, I think, 49% of the individuals that we served with our more in-depth services, so our ISEP program, home delivered meals, case management, they did not have a formal or informal caregiver that they could define. They didn't have direct family supports that lived close by, and close by would be within, half hour to an hour. They lived out of county, even out of state. So we had to look at that, and that number keeps on increasing because we're seeing that a lot of our, younger families are moving out of the area, or our graduates are leaving to go off to college and they're not returning back to the county. So this program really takes a look and helps supplement if a person has informal care, or completely provides the care if they do not have any other support systems. So ISEP funds personal care aides through a contract with North Country Home Services. They have an office right up in Saranac Lake, so if anybody is interested and in need of some additional money and likes to perform, in-home care for older adults, I would definitely recommend that you give them a jingle, as they are desperate in need of home health aides. That's across the nation. It's not just, here in Essex County, but they need more boots on the ground, if you will, assistance with personal care aides. And then, as well as a potential personal care aide that we would fund, we could pay for a personal emergency response system. So a lot of people refer to this as a lifeline. So I just want to give a scenario of an individual that we would, it's not really a scenario, it's an actual live case, but we have an older adult. She lives by herself it's a duplex, so half of the house is hers, half is her her granddaughter's, excuse me. But her granddaughter works at the local school every single day, and the granddaughter's husband works actually out of state. So she is home by herself at 103 years of age every single day. So we got a call a few years ago. This has been a client that has been with us for, I think, 8 or 9 years now. She definitely had some mobility issues. She was experiencing falls while her granddaughter was at work, was not able to call her granddaughter. Luckily, when she had these falls, back when she became a client, first became a client of ours, she did not experience any type of injury, but she lied on the floor until her granddaughter got home. Sometimes this was 1 hour, sometimes this was 2 hours, sometimes this was 8 hours after her granddaughter had left. She got up, went to get some breakfast, get herself ready for the day, experienced a fall, was not able to get herself up, laid there until her granddaughter got home a little after 3. So the granddaughter luckily called us, and she met with a case manager. We were able to get her a lifeline. We were able to link her through her primary care physician to obtain physical therapy services. She then got a walker. We put a home health aide in there because a lot of the times that she experienced the falls was when she was doing any type of her ADLs or IADLs. So those are the daily living skills, from her personal care, or using the bathroom, to her meal prep. So we put an aide in there for 3 hours every single day, Monday through Friday. And she is I said she's 103, she's 104 now. And I think the last time we did the figures, it cost us about just over $1,000 for all of her services for a month. And it easily has kept her out of the nursing home. She has had very, very, very limited ER visits. We all know that emergency room visits are very, very expensive. But just investing in her a little over $1,000 a month has allowed her to remain in her home where she wants to be. It has kept her off from the Medicaid insurance for long-term care. because up here in Essex County and across the state, individuals, quite the majority of older adults that are in a nursing home or individuals that are residents of a nursing home, Medicaid is their payer source. So we have saved the payers, Medicaid, a ton of money. And most importantly, like I said, we've allowed her the opportunity to be as independent as possible for her to age in place. I talked about this really briefly a little bit ago, our health promotion program. So we contract with Cornell Cooperative Extension, and they provide older adults the opportunity in Jay and in Ticonderoga, the arthritis exercise program, and Tai Chi for arthritis also in Ticonderoga. And then we worked with the Retired Senior Volunteer Program through their volunteers who also became trained Tai Chi for arthritis leaders. And they've offered that program in Willsboro, Port Henry, Ticonderoga. We were just in the midst of getting ready to roll it out to other communities. And then March hit us and our world was turned upside down with COVID. So hopefully 2021 we'll be able to provide these opportunities for older adults to get out and exercise at their pace. A lot of people, when we talk about older adults and exercise, there's that stigma that older adults are just those individuals that, they're in a wheelchair, they're in a walker or using a walker. And that's not the case. We can work individuals in all different abilities to provide these opportunities. So there's actual arthritis exercise programs for individuals that rely on their wheelchair, rely on their walker. So we have a wide variety of individuals that utilize these programs. So our next program that we offer is our health insurance information counseling and assistance program. I'll refer to it going forward as HICAP. And our HICAP program provides free and accurate objective information, counseling and assistance, advocacy on Medicare, private health insurance, and related health coverage. We help people with Medicare, their caregivers or representatives, or persons soon to be eligible for Medicare. And all of our staff are state certified health insurance counselors. And within the next, I would say 3-4 weeks, anytime that you turn on your TV, you're going to start seeing ads for Humana, ads for United Healthcare. And that's really what they're targeting is older adults that have Medicare coverage for our older adults to purchase their products. What's really great about our staff is we are not affiliated with any type of insurance company. So an older adult will come into us, we will talk about their coverage, we will look at their coverage, and we will provide them unbiased information and education that'll allow them the opportunity to make the best decision for their coverage. So within the next couple of weeks, I mentioned that you'll see all of these ads on TV, in the newspaper. That is because Medicare open enrollment starts on October 15th and ends on December 7th, I believe. And this is a time that anybody that has Medicare, that has a prescription drug plan through a Medicare Part D for drugs, that is the time that they really want to look at their coverage for next year. As you may know, health insurances, they change their coverage from year to year. It may be their copay structure, their tier structure. It could be what their annual deductible is, what their annual or monthly premium is. So during that month and a half time frame, we encourage anybody that has prescription drug coverage or an Advantage plan through Medicare, give us a call. We will take a look at all of their coverage with them. This includes putting all of their doctors into a website, includes putting their medications in to make sure that their coverage for 2021 is the best coverage for them, the most affordable. It covers their health needs. And we want to do this so that way, if somebody does not look at their coverage And then in 2021, all of a sudden, maybe their doctor is not in network. Now they're responsible for that. Maybe one of their extremely expensive medications is now not covered, or the tier has changed, so their copay is much more, which they potentially could not afford. So we always want to do this. It is extremely time consuming, but in the end, it completely pays off. So that way there's no surprises for the next year. We also get a ton of individuals that are new to Medicare because you are eligible for Medicare in a few different ways. So typically you're eligible for Medicare due to age, and that is when you turn 65. So the first day of the month that you turn 65 potentially would be your Medicare effective date. There's a couple different scenarios that could change that. You could become Medicare eligible due to disability. So if you had received Social Security disability and had been approved for that 24 months after you were deemed eligible, that is when your Medicare will go into effect. So we get a lot of calls for individuals that are new to Medicare because they don't know how to navigate the system, how to navigate through Medicare. Medicare is very, very, very tricky. So we can provide all of that information and education to any of those Medicare beneficiaries. Home delivered meals is actually probably I think the most important and the biggest program that our office provides. So a lot of people refer to this on Meals on Wheels, home delivered meals, whatever you'd like to refer to it as. But these are meals that are delivered to homebound individuals that are unable to safely prepare a balanced meal for themselves. And it is funded by our office, but again, Adirondack Community Action Program, they operate the program as well as that congregate meal program. And right now, Kathleen, with your permission, I'd like to use the chat box for a little, to be a little interactive, because I'd like to see from everybody in the audience, what do you feel is an important aspect of a home delivered meal program? Obviously the meal coming in is really important. People, older adults may have some mobility issues. They may not be able to stand to prepare a meal. They may have some cognitive impairment that does not allow them to, safely prepare a meal. But what else do you think is an important aspect of the home delivered meal program? And as you guys are, typing in, hopefully this works. I'll keep an eye on that, but then also just move on to the next slide, and then we'll circle back to home delivered meals if you guys would like to put that in there. Another program that we offer is information and assistance. So information and assistance is just providing individuals with information on services that are available to them. And then we're able to link individuals to the services and opportunities that are also available within their community. So it could be services that we offer here in our office. It could be maybe a service that's provided by social services, maybe through a not-for-profit. Our staff, we have monthly trainings to make sure that our staff are very familiar with all the various programs that are offered within Essex County or in our surrounding counties that our older adults could access. And our staff will be able to link them with those services and really either do a direct referral to that agency for that program, or actually, if there's an application process, would be able to I'm sorry, the chat just caught me off guard here. Help them with that application process to get them from start to finish to be able to ensure that they're getting those services. So the one negative thing with our information and assistance program is that there's a lot of services for older adults out there. However, there's a lot of eligibility. There's a lot of financial criteria that individuals must meet. There may be some age restrictions. Our home program is for individuals that are 60 and over. So we sometimes get calls for individuals that have a disability and they're maybe 55, and unfortunately we're not able to provide to them. So the only negative drawback on the information assistance program is that it's not always that there's a program on the other end that could be potentially benefit somebody or assist them for their needs. So we struggle with that sometimes. In-home contact and support. So these are services and activities that are designed to provide support to older adults who are isolated due to physical and or cognitive limitations. So we work with, again, not only do our staff provide this program, but we also work with the Retired Senior Volunteer Program. So it could be bringing individuals to go shopping. It could be friendly visiting, so they could, pick up their older adult friend, and they could go off to lunch, and just have that socialization. We do a lot of telephone reassurance, so it could be that we call them, or a volunteer calls them on a weekly basis just to check in. So it's it's a small program that we operate, but extremely, extremely beneficial. So legal assistance. So we contract with the Rural Law Center out of Plattsburgh, and we work with Heather Deer West as our attorney that we work with, and she provides free legal services to older adults. To include setting up a power of attorney, establishing an estate will, simple land transfers, and provides all of this. Right now it's over the phone, but gets all of these legal affairs in order, and she sends us the bill, we pay it, and then we provide the opportunity to older adults to contribute back. So if anybody has ever worked with an attorney, you know that it could be quite costly, even for the simplest of tasks. A power of attorney does not need to be established through an attorney. Some people want to do that just to make sure that their affairs are in order, but they don't want to or could not necessarily fund the obtaining a power of attorney. So same thing with setting up an estate will, simple land transfers, very costly services. We pay for this, so that way it's one less thing if an older adult passes on or anything along those lines. This will allow for their family members to have that less stress. So now I'm going to jump back into the chat just because I see that there's a few coming in. And I'm really interested to see what you have to say. So let's see. Social aspects. Some of the people may not be able to get out and about as much as they would like to, and would like to chat with somebody for even just a few minutes. Absolutely. Want to check up on the individual, definitely. And socialization. So spot on. I always talk when I get a call or I meet with groups about home delivered meals. I always say that the meal is an added perk to the program. It's not the sole responsibility of the program. We do get a lot of requests for home delivered meals because of a person not able to, again, like I mentioned when we talked about the program, that they're not able to maybe, stand long enough to prepare their meal. I always say the most important part of this program is having eyes and ears on that older adult that may be at home by themselves for days on end. They may not have, a few of you mentioned the socialization, may not have any type of relationship with another individual, or maybe not a consistent relationship. So these drivers are so important to these home delivered meal clients. So what typically happens, and again, I'm going to say typically because right now due to COVID, it's all has changed because we're trying to do less contact deliveries. So typically what would happen is our driver would, go in and see, hi, Mrs. Jones, how are you today? And, have that couple of minute conversation just to check in, make sure everything's good. They leave the meal. In the event that Mrs. Jones, maybe yesterday she was in her chair, just not her perky self. Today she's on the couch, just not feeling the greatest. Our driver is going to pick up on that. And then what's going to happen is they're going to contact us. We're going to follow up with Mrs. Jones, follow up with her contacts if we have that, to ensure that if she needs to, see her doctor, maybe she's, missing a medication or what have you, but we want to pick up on that before anything goes completely out of hand and Mrs. Jones ends up in the hospital. I am seeing that one of the students just put in about an elderly friend, that passed away in August. So I want to talk about that also, is that, in speaking with older adults that may not have a lot of supports in their life, our drivers potentially could be the only person that person sees weekly, monthly, at all. And unfortunately, there have been times that our driver has went to deliver, and if they have not been able to get acknowledgement from their client that they're delivering to, again, that is another call back to us. And then we have a process that we call the house, we call their contacts if we have them, we touch base with the local hospitals, their primary care physician. In the event that we cannot gain access to that older adult through the phone or through an emergency contact, we do a welfare check with the local police departments or New York State Police. And there have been times that, due to this process and due to the driver, not being able to get that acknowledgement, we've been able to actually, I say we, the state police and the emergency responders, that client may have experienced a significant fall and needed medical attention, but they weren't able to get that. So this welfare check was able to get them access. And then unfortunately, there have been, even, 2020, this year has been probably the highest numbers that we've seen that our drivers have found, unfortunately, our clients deceased in the home. So the home delivered meal program, I just can't stress it enough that it's not just home delivered meals. It's that social aspect. It's that health and safety and wellness check, and the nutrition aspect as well. So thank you very much for everybody that participated in that chat. I really appreciate that. So nutrition counseling, talking about home delivered meals, we want to ensure that all of our meals are nutritionally balanced. So we have a registered dietitian that we work with, and she analyzes our menu to ensure that it meets 1/3 of our recommended daily value. For older adults, it's a little bit different dietary wise than maybe for you or I. So they really look at all of the nutrients, the vitamins, really, really, really hone in on the sodium content. And very fortunate that she also provides nutrition counseling on a one-on-one basis to older adults that would request that. Right now, everything is, again, over the phone or through the mail. But typically prior to COVID, it was done in the person's home. And she can really just work with them on, what is a good diet for them? What's a realistic diet for somebody? They may live in what we refer to as a food desert, so they don't have a large grocery center or store within reach for them. So they rely on local mom and pop stores, which are great, but they may not have all of the products, the healthy products that, the bigger stores may have. So she really can work with them one-on-one. We get a lot of referrals for individuals that maybe have a new health diagnosis. So maybe they are, now diagnosed with having diabetes or high blood pressure or high cholesterol. So she can work with them and, look at what they're typically eating on a day-to-day basis. And then, how they can tailor that to realistically, meet their health needs. We do get a lot of calls for individuals that now reside by themselves. They may have lost a spouse. They may have, a spouse may have had to enter into the next level of care. So they're not used to preparing balanced meals for themselves. So they find themselves eating frozen or canned products. So, they want different tips and help trying to navigate through that. So we always say, when in doubt, just refer to us. And what's really great about this program is that it's all tied back to their primary care physician, despite not having to pay any type of copays. So our registered dietitian will write up a report and keep that primary care physician in the loop, so that way everybody's on the same page. New York Connects is a program that provides services to everybody. So it's a trusted resources for anyone needing information regarding long-term care services and supports. This may include an older adult. It could include a child or an adult with disability. It could include caregivers, family members, but basically, in a nutshell, it really functions as a no wrong door or a hub for information on a wide range of available services and support. So we always say that we refer individuals from basically birth to death, quite frankly, to services, to long-term support services. So we've worked with moms before that had children with disabilities that did not know how to navigate through that system. So we were able to link them with the early intervention program. We've worked with individuals, 30, 40, 50-year-olds with disability to navigate through how to access Social Security disability, how to navigate through the different insurance systems, help link them to services. And then of all means, we always work with older adults and their caregivers. So right here is all of our contact information. There's my email. We also have a Facebook page. We try to be as active as we can on that. So we encourage everybody to go on our Facebook page and like us. Our main office number is there. Like I said, my email. I'm always open for if anybody has any questions, give me a call. We were very, very, very fortunate last year, a year and a half ago, to have an intern from North Country. She came in, she did an amazing, amazing, amazing job. And it just happened that we had a retirement right as her internship was ending. And she has now been with us for just under a year, I believe, or maybe a little over a year. I'm not too sure. And it was just, I could not explain how amazing it just worked. Like all the pieces fell right to the puzzle. So it was really great. So I know you guys have some questions for me that I did not answer. So if you want to, Kathleen, what was are there other questions that they need to answer?
So this is their first site visit. They know
Okay.
that they have a site visit report that they have to write up. So I think this is a great idea, great time for students to kind of pop in and have a discussion with you and ask any questions. They have the outline, so they kind of know what they have to write about. So if there's anything that Chrissy did not discuss, or any questions that you have for her in regards to the programs that she discussed, please raise your hand now or type in the chat so that you can get those answers and then also be able to write the site visit report.
Absolutely. Please ask questions. This is my favorite part. I got to step away really quick though. So while you guys are chatting, I'm just going to give a few other quick updates as to other really what we feel is really cool programs that we provided, that they're more pilot based. So one thing that we have done, which is really cool up here in Essex County, is we've worked with Cornell Cooperative Extension. is a container garden program. And all of this, you'll see if you go to our Facebook page, you'll see these different pictures. So we worked with Cornell in their 4-H program, and their 4-Hers actually and master gardeners prepared a container garden. So a garden in a bucket, if you will. So it's a 5-gallon pail with some soil, and it comes with a green pepper plant, a tomato plant, some herbs, basically just a salad in a bucket, if you will. And we provided this to older adults that may in the past been able to maintain a garden, but now maybe due to their age, due to their health, they weren't able to do that anymore, but they still wanted that sense of gardening. We were provided these to individuals that may have had to or have chosen to leave their home and to go into senior housing, so they may not have the land to be able to maintain a garden, but it still gives them that sense of gardening, if you will. We also worked, and I'll show you these really cool guys here. We were a pilot program. We were one of 10 counties across the state that were asked by the New York State Office for the Aging to pilot a companion pet project. So if I would have thought ahead of time, I would have taken this little guy out of the box, but can everybody see this? So this little guy is a, through Ageless Innovations, Joy for All, it's a companion pet. And they come in cats and they come in dogs, and it is really used to provide, again, decrease that social isolation for older adults. But it is just it's a cat that's robotic or a dog that's robotic, and it really responds to an older adult or whoever their owner is. So we provided the first round, we provided, I think, 14 out to older adults. And then we did a survey every 2 months to see how the person felt, socially and emotionally and mentally. And we saw from our 14 individuals that we surveyed that absolutely every single one, except for one, she went into the nursing home, saw a drastic change in their social and emotional mental, if you will. And literally, this is a cat or a dog that it's actually amazing. You sit there and you pet it and it purrs. It'll roll over on its back and you can rub their belly, but they really respond to touch. And if you do not touch them and do not engage with them, the cat is meowing and the dog is barking at you, and it's just truly amazing. We had one quick example is we had this woman that had, and I want to say that she named her cat Mickey, and she had lost her husband a couple years back, had struggled with that loss, had some type of some memory, changes going on. But we gave her this cat, and Mickey was just the joy of her life. What we did see, though, is after about 2 weeks of having Mickey, there was a change in our client. She was very active at our senior club, at our nutrition site, and after about 2 weeks, she no longer wanted to go to that site. She kept on saying that she couldn't leave Mickey anymore. So that definitely was something that we didn't want to hear. We then were getting contact by her caregiver and her one of her children, stating that she didn't want to go to doctor's appointments anymore because she never wanted to leave Mickey by himself, what have you. Was very concerned because nobody was buying Mickey food. Obviously, the cat didn't need food. Then there was a time, this was about a week and a half time span that this was going on. And the last part was that her stating that she was not going to go back to the site, did not need to leave the house anymore because it broke her heart every time that she came back. Mickey would jump off the couch and meet her at the door and just and cry and meow. We knew that was obviously not happening. So we referred her to her primary care physician, and actually our client was experiencing a urinary tract infection that in sense basically explained all of these unrealistic things that Mickey was doing. She got on medication, she was good to go, and then she understood that, you know, Mickey did not need to eat. She tried to serve Mickey eat oatmeal, so we actually had to replace Mickey, and Mickey had to become a new Mickey. But it's just one more way to, you know, increase socialization. We've actually just during COVID received another shipment, and we've deployed these out to again older adults that you know, could benefit from this. Maybe they had animals in the past, but now aren't able to, you know, due to health or what have you, be able to have access to a cat or a dog because they can't afford it or they can't maintain the dog anymore, or the cat. This is just a added perk. And I do see that somebody had put in there that they've seen this at Mercy. Mercy is a nursing home. Absolutely, a lot of nursing homes, a lot of hospitals, especially for long stays in a hospital, they have access to these companion pets. We actually learned about this. Our director at the state level read an article through one of the VA hospitals somewhere in the States and wanted to learn about it. And then his 9-year-old daughter had asked, she found it on Amazon or somewhere as a companion pet, and he said, what a great opportunity for you know, older adults in our network to be able to have access to. So yes. While the questions comments keep on coming in, another really awesome thing that we will be a part of is a opportunity in the, again, prior to COVID, we were just getting ready to implement this in person, but now we're going to do it virtually, is through a creative arts program. The North Country is going to be a region that's going to roll out a program that allows older adults to become actively engaged in some form of arts. So, you know, it's going to be really tailored to the county. But what we would do is we would work with a local artist. So this could be somebody that focuses on pottery or watercolors, or even, you know, creative arts is like theater and drama. Get everybody that would be willing to be a part of this project together virtually and be able to roll out over 6 weeks, you know, different opportunities for individuals to become engaged in that art. So if we did watercolors, we would deploy all the materials for older adults that wanted to do maybe kind of like a, I think they refer to them as like a paint and sip. There would be no sipping in our way, but you know, that artist would be able to walk through our older adults with all the different ways to the techniques or the tips or whatever for that. So that's something we're really excited to roll out in the hopefully in the near future. So I see a question, can older adults use them for anxiety and depression? Will they help with those specific issues? You might have said it in the beginning and I just missed it. No, I don't think I said that, but absolutely, absolutely, individuals, older adults can use them for anxiety and depression. They definitely do help. It refers me back to another a client that we deployed a little kitty to. She struggled significantly with anxiety due to her living arrangements. And she told us that just literally having the cat on her lap, by her petting it, and you could actually feel it purr on your lap and you can hear it, just stroking the cat and listening to that really helped her through really, really, really tough times for her. So absolutely, absolutely, it can be used for a wide variety, but definitely anxiety, depression, isolation, a lot of those. Yep. Any other questions?
It does not look like there are any questions at this point. So I really, again, I really appreciate you coming on live. You know, we miss being in the classroom, and we always have these site visits, you know, either in the classroom or sometimes we're able to go on site to certain agencies, and we certainly will miss that this semester, but I'm so very grateful that you have, you know, you've agreed to do this, the virtual site visit. You know, it's still, I know that the students have learned a lot, you know, with this, and I'll have some discussions with them in previous or future visits with them. But this is so very important to learn about these services. So again, thank you so much for spending the time with us to teach, you know, the students about the services. So very important. So thank you again, Chrissy.
Absolutely, and thank you guys. Again, if there's ever any questions going forward, don't hesitate. You have my contact information. Give me a call, shoot me an email. You know, I spoke today on Essex County services. I'm sure that, you know, some of the students maybe reside in other counties. There is an Office for the Aging. Some people refer to us as AAA's Area Agency on Aging. There's one of us in every county. So my counterparts across from the state would be definitely, you know, if somebody wants to reach out to Michelle in Franklin or Darlene in Clinton or whatever county you're from, I know that they would have the same response, that they would be definitely interested in just, you know, passing along their information, because we all have our core supports or programs, but we all offer them in a different manner. So how I provide our health promotion, so our exercise programs, is a little bit different than what Franklin and Clinton does, or, you know, downstate. So across the board, just give us a call, and we would be more than happy to walk you through anything. And thank you guys for listening to me ramble on for over an hour. I appreciate it.
Right. Well, thank you again. And for the students, you know that you have a site visit paper that will be due, and that information is on Blackboard for you. So again, thank you, and I hope everybody has a great day.
Yes, thanks guys. Stay safe and healthy. Wear your masks.